Hey, good morning, everyone. It is Friday morning here, 7:30 a.m. I've been here in my office. I had a few interviews this morning for a conference I'm speaking at later this month, and I just wanted to do a quick Facebook Live here on some important topics. I often get a lot of questions on Facebook on my fan page regarding, can chiropractic help my child with this disorder? Can my chiropractic help my child with this other disorder? And this is actually, it's an interesting question for me because I often got this same question from my mom early on before she really understood what chiropractic was. She would always ask me, can chiropractic help this? Can chiropractic help this? Can chiropractic help my friend's issue? All these different things. And so to really understand if chiropractic can help ADHD, sensory processing disorder, autism, anxiety, all these different childhood disorders, behavioral situations, we really need to start by asking ourselves this important question. And it's this one here. It's the question, which of those disorders, which of those health situations are not affected by the nervous system? Okay, so and this can go for any disorder, any health situation, which of these health situations are not impacted by the nervous system? Okay, and so this is a super important question. It's one that's often neglected because the answer to that question is that none of them, all of those disorders, any health situation, is by the nature of our anatomy and our physiology necessarily going to be impacted by the health and state of the nervous system. Sometimes primarily, sometimes the nervous system is the primary cause of that situation. Other times it's involved in that situation and making the situation worse. And so we need to ask ourselves then, what is the state and health of my child's nervous system? And very few people have ever really had that evaluated. Some people may have an EEG done. They may look at the brain activity. They may look at an MRI. They may look at these different tests. But a lot of these tests don't really tell us about the functional capacity or the function of the nervous system. So let's take a step back. The nervous system is really divided into two very important parts. It's called the autonomic nervous system, and in there's two parts of that system. The autonomic nervous system controls everything automatically for us. Like we don't have to think about breathing. We don't have to think about digesting our food. We don't have to think about our heart beating. All those things are regulated for us, and it's regulated based upon what's going on in our environment. Say if there was a pit bull barking at us, or a tiger or something that in our environment, we would be really stressed. Our body would go into what's known as a fight or flight response. That's one side of your nervous system. It's there for survival. It gets our body focused on survival and not focused on things like growth, learning, and development, and healing or repair. It's focused only on how do I survive in this moment. The other side of that autonomic nervous system is disorder, seizures, anxiety, all these different things. We then need to ask ourselves, well, what is chiropractic? And in a nutshell, chiropractic is the healthcare profession that is concerned with the role of the spine in the function of the nervous system, how the spine can impact and alter the health and function of the nervous system. You see, because the spine houses and protects the spinal cord. And so due to various stressors in life, and there's a lot of them, from physical stressors, birth trauma, to falls, to injuries, to chemical stressors, things that are in our environment, from pesticides to things that we build our homes with, to different things in our foods, in our air, water quality, things like that, to mental emotional factors. All these various stressors impact our body, and when we're stressed, that will negatively impact the spine and cause what's known as a subluxation, a misalignment of a vertebrae, which will necessarily then impact and affect that nervous system that travels through the spinal column. And so when we ask ourselves this question, can chiropractic help ADHD? Can chiropractic help autism? Can it help anxiety? Can it help all these different situations? We need to understand that the role of chiropractic is to look at the health and function of the nervous system and see if subluxation is involved in negatively impacting the health of that system. And if we find that and we correct that, then by nature, the body will start to heal and grow and develop in a much better way than it was previously doing. And so here in this office, we measure how the nervous system is functioning. We use heart rate variability. Heart rate variability is one of the gold standards for measuring the balance of that autonomic nervous system versus that fight or flight system. Okay, or that fight or flight versus that resting, healing, digesting side of things. We can monitor and see if a child or an adult or any person for that matter is in a state of fight or flight. If their body is more stressed and it's not getting into the healing, resting, digesting, and development mode of physiology. We use paraspinal thermography. We're measuring skin temperature differences along the spinal column, looking for any major swings in temperature differences, because the temperature along the spine should be within a known range. I've done studies on this, and it should be about 0.5 degrees. And so if there's big shifts in skin temperature, we can see that there's a functional imbalance in the nervous system in that area. Another test we do is surface EMG. We're measuring the electrical impulses going to the muscles along the spine. So we measure the functional capacity of the nervous system. How is that nervous system functioning? And then determine if subluxation, if a misalignment of the vertebral column is impacting that nervous system. And then we go about correcting that. And so as we do that, we naturally will see improvements. If a child is in fight or flight, we will start to see them get into the resting, healing, digesting side of things. We have studies that show that this is what chiropractic does, and we have the results that we see. We see kids that now are able to transition better. They're able to, we see kids that have improved speech. We see kids that have major improvement in their behavior, both at home and at school. And we're seeing these fantastic changes. And this is why I do these workshops here in San Diego and work with doctors throughout the country to help get this message out there. And so I encourage you, if you're watching this, if you're already a practice member, here in the office, share this information. Share it with different Facebook groups. Share it on your timeline. Share it all around the internet, because parents need to understand this information and have access. I see, I have someone watching the video right now who we had this conversation yesterday. They didn't know. Their child is 3 years old. They wish that they had brought him in sooner. When they were given a diagnosis of autism at 18 months, and how that would have shifted his development earlier on in the course of his life. He's still making fantastic strides and improvements. However, parents need to know this information, and right now this is not common knowledge, unfortunately. And so this is why you see me on Facebook. This is why I do Facebook ads. This is why I'm out in my community locally, and why I travel around the nation and internationally sharing this message, because it's my moral obligation to do so. So I ask and encourage you to share it with your friends and your family members, whether they're here in San Diego or throughout the country. If you need a referral, I can help you find one anywhere throughout the country. Send me a Facebook message. I'm super accessible. If you have a question about your child, and if I can help, just send me a message. I'm super accessible. I really appreciate all of you out there on our fan page. We're going to have some really cool stuff coming down the pipeline here. We are doing a mental health workshop starting next week. I'm super excited to do that mental health workshop, addressing anxiety, depression, OCD, post-traumatic stress disorder, super huge topics, especially here in San Diego with we have a huge military basis here. That post-traumatic stress disorder is major situation that needs to be talked about. And when you think about post-traumatic stress disorder, you just think of it from, again, a nervous system perspective. Someone has been exposed to some intense trauma, some intense physical trauma or mental emotional trauma, and it causes a shock to that system. It causes someone to get stuck in fight or flight. Their fight or flight response becomes almost ingrained in a loop where that body can't get out of fight or flight. And so now they are just stuck in this state of constant anxiety, the state of constant fight or flight, where they can't rest, they can't sleep, they can't get into that resting, healing, digesting, development side of things, where they should be able to get back into a balanced, centered state. So that next workshop will be Wednesday the 9th here in our office. I believe it's been booked. We may have a few spots, and if you really want to get into that, we'll be having more in the future. But thanks so much, everybody, for tuning in and for sharing this message today. If you have any questions, just post them in the comments below, and I'll cover that on another Facebook Live at some point. And really appreciate you and your support of my work and the mission that I'm on here. Thanks so much. Have a great day and weekend. Bye.